Welcome to Crushing It. I'm Jonathan Trimble. My co-founder Rob and I came from the FBI and the military, where the stakes were real and excuses didn't matter. We learned that persistence wins. You don't choose the situation, only your response. Those lessons shaped how we built Bond, helping businesses understand cyber risk and confront it with confidence. Business is its own battlefield. No fluff, no excuses, just leaders who step up. Let's dive in.
Okay. Good morning, everybody, and good afternoon to Ed. So with me today is Ed McDermott and also co-host Rob Cochran. How things been going this week, Rob?
Busy as normal, John.
Okay, all right. I was asking Rob what to ask him, and he left it wide open. So there we go. All right. So today we're talking with Ed McDermott from the United Kingdom, who took a blank sheet of paper and over the course of 3 intense years built EMMAC Life Sciences, which became CureLeaf International, which is a fully integrated cannabis operation across Europe. And so this wasn't just a smooth glide path. We're talking about regulatory frameworks that didn't fully exist yet, navigating across cultural approaches across multiple European countries, committing millions of euros, not just based on what there weren't written rules in place at the time, but just trying to understanding how those rules eventually be applied. And then adding to that the global pandemic and a few lights out moments where capital had to be raised or the whole thing would be quickly stalled. So it's not just a cannabis story. It's really the central theme of Crushing It, story about risk, resilience, capital, leadership under pressure, and what it takes to build under ambiguity. So Ed, welcome. Really happy you're here with us today.
Thank you very much, Jonathan and Rob. Very kind of you to get me on. Always happy to talk about these things. It's fun.
Yeah. So I guess let's start, when you start at the beginning, how did this go from like a blank sheet of paper to one of the largest cannabis ventures in Europe?
So for us, it was a case of we'd seen a lot of this already happening in North America. So it wasn't a completely blank sheet of paper in terms of there was no playbook. We had obviously seen how North America and particularly Canada had rolled out its medical cannabis and then ultimately become an adult use nation. We knew that the adult use thing was never likely to happen in the UK in any time, and even across Europe, it wasn't likely to happen anytime soon. So we didn't really have that as an opportunity. We were very much looking at it from the pure medicinal perspective. And of course, the over-the-counter kind of supplement. You'll remember CBD was all the rage at one point. And it was really just what has happened in consumer products for a long time. They, in the wellness sector, they typically will latch on to a particular ingredient and that will become all the rage for a while. That bit was very challenging still, but it was at least a path that was well trodden with lots of other supplements and ingredients companies over the years. The bit that was really difficult and where we felt the vast majority of the value was in the pharmaceutical piece, which is obviously very highly regulated. The laws were changing in different countries within Europe in different nuanced ways. So we had already seen how these vertically integrated companies had come together in Canada, and we'd been investing in some of them. And we'd also actually been very close to a company that was built in Canada to do exactly this, create a vertically integrated medical cannabis company, which then ultimately became an adult use business. In our case, it was really a case of both understanding the framework as it existed, and in absence of a framework, working out what we thought might happen with good guesswork along with some sort of on the ground understanding of how those cultures worked, how typically they would roll out a new highly regulated situation, a bit like online gaming. So we had that in our mind as well as how did companies work with governments effectively to roll out something that was totally new.
Yeah, and you mentioned previously that your first 18 months were unsustainable, which probably resonates with just about anybody starting a business. Like you're just kind of scrambling and kind of trying to make something out of nothing. What did that look like for you?
It's a weird one. For me, I look back on it so fondly. It was probably one of the weirdly happiest times of my life because I was just so heavily involved in what was happening, reacting, preempting, building a team at the same time. And I had co-founders fairly quickly after starting the company and some very, very smart people. And it was a case of working out how everyone's skill sets came together, where we were all placed, kind of taking the ego out of it a little bit to sort of go, what do I want as a result here? where am I best placed? What are my real strengths? Needs to be doing the things that I'm really bad at. So, I quickly worked out, for example, that I really understood the UK very well. I had good sort of political connections that I'd started to build just by attending lots of events, by contacting MPs and trying to get an understanding of where they sat on these issues. So I focused very much on the UK, but obviously as a founder and board member, I still was, privy to what we were going to do in other countries. But for example, one of my co-founders is an Italian gentleman named Antonio Costanzo, very statesman-like guy, speaks a huge amount of languages. He was the right guy to be sort of CEO of the whole business, so to speak, presented beautifully, had been through online gaming, had been involved in Uber, so really understood the positioning and how to deal with the European government and ministers where it came to effectively rolling out something that was highly regulated. And then, making sure that our finance function was really strong. The first sort of 6 to 9 months, I was doing all the, bank payments, everything. And that, again, was just a total waste, useless piece of my time because it was something that anybody, with fairly low acumen could do. And it was detracting away from, the important job, which was building out the UK. And I would say, we still have an incredible business there. Of course, it's now under new ownership and it's really only gone from strength to strength. But those first 18 months, it's that blend of, working out, making lots of mistakes, not utilizing your time very well, working out how to do that better whilst doing the hiring, whilst, helping to nurture a culture. And, culture was probably one of the biggest reasons we won, I think, in the end. So really working hard on that. And, I think perhaps fortuitously, we just hired extremely well and we got people that were all really aligned with what we were trying to achieve. And, I'd never seen a group of people work so hard, but perhaps until my most recent venture, which has been a kind of similar story. But yeah, it was definitely frenetic 18 months. But when I look back on fondly.
So how was the team formed? I mean, did you guys know each other beforehand, coming from different cultures?
Yeah, there was a
Curious how you did that.
combination of, we all had the founders, myself, Antonio, and a couple of other guys, we all had very strong networks already. And the vast majority of the team the sort of initial team, the first sort of, let's say 20 people, came from people that we already knew, who we'd worked with in other industries. So we had a good understanding of what their capabilities were, what their skill sets were. And I think largely we got those hires right. Obviously, it was when the company started to reach a bit of a critical mass of people that, the hiring became more difficult because you were tending to hire people that you didn't know, or you were getting people through bits of acquisition that we were doing along the way. But we were very lucky that we had a really good network, and because we'd all been involved in sort of many different industries, but typically highly regulated, there were people that clearly bought into this new and exciting industry that didn't really exist before. And there was also that other side of it is that, like, we're going up against the black market and we're the kind of the good guys doing it the right way.
And I got to ask, I'm a big fan of the space right now. My father passed away from pancreatic cancer, and it's a terrible disease and a horrible way to die. I will say during the later stages, the only thing that gave him any type of release whatsoever was cannabis-based oils that he would take. It was literally the only thing other than all the pharmaceuticals, all the other drugs. And I started looking into it a lot more, became very hopeful that the world would get behind wanting to understand the medical benefits of cannabis more. And so very hopeful, very promising. It seems like we're getting there. But one thing that's striking to me and almost kind of comical from an American standpoint is that, ultra conservative, or at least the perception, the ultra conservative Germany is the first one to adopt cannabis legally in the entire country or the entire continent. What are your thoughts on why Germany would lead the way in something like this?
It's a very funny thing. Germany is such a unique culture. Again, that was one of the things that we always had in the forefront of our mind, because we were seeing, Canadian companies and US companies drop in their kind of US guy or their Canadian guy who was coming in and going, oh, no, this is how we do things in North America. This is how you guys are going to do things. And the Germans were like, oh, no, this is not how, sorry, poor impression there. But, they're very meticulous in the way they do things, Germany, but they are actually surprisingly progressive in the way that they look at things. And they're willing to adopt ideas and, evidence-based things, perhaps more so than a lot of other cultures. And I do a lot of motor racing. That's my big, big passion in life. And Germany is a place, I've raced at Nürburgring and places like that.
Lucky
And they
dog.
are just an incredibly unique bunch, I think, the Germans. But when you look at what they produce in terms of their engineering, in terms of some of the incredible businesses that Germany's built, it is amazing how some very, very conservative nations can adopt something because, like you said, they've seen either firsthand or they've read about the benefits of something that has always been demonized, and perhaps they're just a little bit more progressive in going, okay, maybe it's not as bad as it sounds. And, these people who have serious problems, they aren't what I would call a quasi-recreational user, i.e. somebody that's utilizing the medical system to get drugs because they like drugs. And similarly to yourself, I've had, family members who've passed away and from, horrible diseases like brain tumors, and things like cannabis have made a huge difference. And there's enough evidence to support that cannabis can make a huge difference in terms of your medical treatment alongside perhaps traditional pharmaceutical techniques. And we're also starting to see that now with psychedelics and, neurological issues and, of course, mental health conditions. So, and again, somewhere like Germany has been quite embracing of that. They do things in a very specific way, as does every territory in Europe. They have a very specific framework that they like to work with. They don't get bullied on it. But, they also were one of the first in Europe to effectively trial adult use cannabis. I can't say for sure that has been a resounding success as yet, but yeah, no, it's very interesting to see how some of these quite conservative nations, I mean, the UK is also a very conservative place, and I think the vehicle that was utilized in the US, for example, was PTSD and injured servicemen, because North America really cares about, or certainly says that they care about their veterans. In the UK, that wouldn't have worked. We sadly don't seem to care enough about our veterans, but we do care about kids. Everyone cares about kids. So the vehicle that was used in the UK was epileptic kids who had severe epilepsy and were going from having hundreds and hundreds of seizures a day to having literally none for years off the back of utilizing medical cannabis. And you can imagine, as a desperate parent with a kid with horrific issues like that, you get to a point where you've done every pharmaceutical going, and then at that point, you're just looking for hope. And for a lot of people, medical cannabis became that hope, and it actually worked. So I think that's where the whole story and the whole industry has kind of blossomed from.
Yeah, it's really interesting that you were basically operating in these different regulatory frameworks that weren't fully developed and didn't really exist, and you had to kind of anticipate ahead of time. And a lot of times in the military or other organizations, we talk about leaders having to make critical decisions without perfect information. And this is kind of like a perfect example of that, where you don't know exactly what it's going to be, maybe 6 months from now. And so how did you work in that state of ambiguity and make decisions? And there are times when you got it right and other times that you got it wrong. And what did it look like?
Well, I think, as I said earlier, there was an element of sort of educated guesswork in this, in that we, instead of trying to write our own set of regulatory framework, we looked intensely at what frameworks there were for drugs that were at that point classed as Schedule 1 across most of Europe. And the push was, how do you find a way to make that Schedule 1 drug, which effectively, if it's a Schedule 1, is considered to be of non-medical use, it's just a hard drug effectively that people use recreationally. And it seemed strange that cannabis was in that. And there was definitely a move towards it being moved to a Schedule 2 or Schedule 3. So it was really trying to understand, what does Schedule 2 or what does Schedule 3 drugs look like? Because they're not pharmaceutically developed enough to be marketed. So they haven't gone through, $200 million worth of clinical trials at that point. There wasn't extensive data that you could utilize. There was quite a lot out of Israel, for example. There'd been trials on it for every disease imaginable, and there was a hell of a lot of interesting data coming out. But the clinical trial process that they didn't align and didn't kind of fit with the framework that was used in other countries. So you would kind of have to start from scratch. But our general view was that cannabis was going to be prescribed as a Schedule II drug in medicinal cases. So it was really getting a really good understanding of how drugs moved in that space, what they needed to have in terms of toxicity studies, what they needed to have in terms of shelf life, who prescribed them? Was it a general practitioner or was it a specialist? And our view was that it was always going to be specialists. So it was really just understanding all of those things and being prepared for that. And in some countries, the regulatory framework, the rescheduling was happening way quicker than we could keep up with. And in other countries, it was much slower. So at times we were behind the curve, and at times we were ahead of that. But the ultimate case was, we also need to acquire businesses because we're moving that quickly. We can't build what they've already built in that time frame. How are those businesses working in today's world? Are they sort of businesses going in the right direction, or are they businesses going in a sort of perhaps negative direction? And we were perhaps fortuitous that in the UK, for example, specials medicine, which is basically bespoke medicines that are created for kids that are sick, for example, or people that can't take medicine a specific way. So quite generic medicines that were being turned into specific formulations so that people could take them accurately. We knew that was kind of the route to being able to distribute these medicines. There was the doctor piece, but there was also the distribution piece, which was, typical pharmacy, but not one that you walk into. It's one where there's a laboratory, things are being made. And we knew that business was kind of on a slightly downward trajectory, but they had all the infrastructure that we needed and the expertise to be able to do it. So in the UK, for example, we bought a business like that. In Spain, we knew that distribution wasn't going to be the priority. It was going to be the actual manufacturing of products. And that means once, in the case of cannabis, for example, if you had an oil, you needed to be able to make sure that it was made under a GMP process. So that we knew we had options of companies that we could buy out there that already had the framework and the laboratory space to do that. We were obviously going to have to augment them, and then we were going to have to get additional licensing for them, but they had the sort of raw ingredients and weren't hugely expensive businesses to buy. So
this is an absolute fascinating topic. I hope you have about 4 hours, because I have about 4 hours of questions for you, man. So I gotta ask, when you talked about, from our standpoint, being a cybersecurity and risk management business, supply chain comes up constantly as a source of, major vulnerability, probably the single greatest vulnerability, other than human beings clicking on things that they shouldn't click on and not having basic security controls in place. But from a cannabis standpoint, I see this massive growth. This is the way that I look at this, and what makes me so exciting about this, not just from the medical breakthroughs that the combination of a new drug could potentially create with combined with AI, potentially doing all sorts of iterations to figure out how to help maybe cure people of significant issues, especially PTSD and some of the other medical conditions that you've talked about. But the supply chain thing for me is, you're going to compete against some of the most advanced criminal organizations on the face of the planet. You're breaking into their cost flow right now, and they don't like that. I can only imagine they're looking at this in a way of like, well, how do we break this whole legal framework and continue to flow our drugs into the world? How do you fingerprint something like cannabis or oils or CBD? How do you fingerprint that in a way that guarantees the consumer that it is actually being produced in a laboratory in this particular country? Any thoughts on that?
Yeah, I mean, one of the really interesting things, blockchain was a big thing when we were, it was kind of what AI is now in terms of hot industries, right? So I think you had kind of blockchain, cybersecurity, and AI all starting to surface around. They kind of got named different things. Industry is very good at kind of promoting themselves in a very specific way. From our perspective, we were very lucky in many ways. Like, our cybersecurity was probably nowhere near as good as it should have been, quite frankly. And in today's world, which is only 4 or 5 years down the line from when we sold the company, 6, 7, or 8 years from when we kind of really initiated it, I suspect, I'm certain that the work that these guys have to do around all these different things is significantly more and much more technical than we had to do. There was a sort of well, there's always been a lot of paperwork associated with medicines, and that was in place, that everything had a batch number, everything had to be tested so that it comes out within a certain quality, within a certain tolerance. If it didn't, it couldn't be passed. And you had to provide all of that data and be able to provide it at any time, especially with, cannabis, to the various regulatory bodies that would come and inspect your facility, that would come to the actual pharmacy, and also the actual tracking of products. So one big thing that we had a real problem with to begin with was a lot of the delivery companies wouldn't work with us because of cannabis. They would just, they couldn't, it was against their framework. They couldn't get the insurance. So there was a hell of a lot of work to do around that. But like I said, we were, as I said, a long way away from where it would be today. And that also goes as far as not just at the point of the production and distribution of the medicine. That would have in the stuff that we had that was patented, because we were working with Imperial College, for example, in the UK. And, we had a huge amount of data that was probably very vulnerable, and we were just very lucky, I think, that we weren't attacked. So I think in today's world, and I'm much more attuned to it now. For example, we have another business that was born to some degree out of myself and a few others who were involved at EMMAC in a new company called Clean Food Group, which is, our big asset there. Our IP is a organism. So it's a yeast organism, effectively. The protection around that is really significant, because if you lose that protection and someone's able to somehow, it would be very difficult. You give someone half a chance to try and emulate the organism that you've created over many years. They may get lucky and you may get very unlucky. I think it's a very interesting point, actually. And again, it's something we could talk about a lot, because I'm sure you guys could educate me a huge amount on the cybersecurity and indeed just defending your IP and your processes. But yes, I think the net of it all is that we were nowhere near as advanced as we now would need to be.
Well, I know of a company that if you are interested in talking more about cybersecurity,
Yeah, very good.
of intellectual property, I think there's a couple places of people that I know you can talk to that could help you secure that and create the appropriate security layers, just in case, anybody out there is interested in
It's
that.
something that, I see a lot, because, now I'm in the position where I also worked in venture capital for a long time. And it's a question that, we ask, obviously, as part of all the pitches that we receive. And there are huge, huge numbers of companies that have very smart people running them, but they are just nowhere near where they need to be on that particular piece.
It's a massive gap right now. We still have it
Yeah.
in 2026. We still haven't figured it out. We have, like you said, absolutely brilliant folks that understand M&A and financials and what makes a company attractive for acquisition. And they can go through it and tell you exactly what it is, but they couldn't tell you step one on how to implement multi-factor authentication on just basic email communications, which means, guess what? Your adversaries are tracking your information, or using AI now and dumping all your intellectual property out into an LLM, into an AI chat box. And now you've just given up massive amounts of information that makes you competitive, and now you're sharing it with the world. So
Yeah, it's very scary. The rise in, every single week I get emails with invoices attached. And, if it was somebody who was kind of, I don't know, in the accounting team that, was kind of performing fairly basic functions, invoices come in, they log them, they put them on the system, they get paid, right? It's not hard to scam companies out of a lot of money from a lot of different places. So yeah, it's
not
an interesting area.
Ed, you talked a little bit about having to raise money over a short period of time. How did you go about that? Because, at least in the U.S., there's, the angel groups and venture capitalists. A lot of them, up to this point, have not wanted to touch cannabis operations. It's kind of like they have a list of things that they won't invest in, and cannabis frequently appears on that list. Did you find the same challenges in Europe, or how did you go about that?
Yeah, I think a lot of the capital that we raised initially was from individuals rather than institutional capital. So we were, again, fortunate that we'd all had previous lives, and thankfully we'd made, as individuals and collectively, we'd made people quite a lot of money in other sectors. So we were kind of coming off the back of, decent wins across different industries. So we were very fortunate that we were able to raise quite a lot of capital from individuals who were, pretty progressive in their thinking, were willing to take a decent amount of risk, but were genuinely excited by the proposition that was put in front of them. When we got to the more kind of institutional level raises, which is, where you're raising, let's say, north of 10 million in a tranche, and, we had a couple of raises that were somewhat north of 10 million sterling, euros, whichever way you want to look at it. They're unfortunately a bit too close these days. But yeah, there were some specific groups that were forming to put together funds to invest in cannabis. And again, a lot of them were of North American origin, but they were very much looking at Europe as the kind of next phase of the industry. We were to some degree fortunate, but we had also put together a really brilliant team that, were incredibly presentable with a very coherent pitch, with a very good understanding of what they were doing. And I suspect probably most people want to believe that their team is the best team, but, I really think we had the most credible team in the space in Europe. And to add to that, there was history with these people of having successful outcomes and being involved in companies that had gone on to become, in some cases, household names. Yeah, it was it wasn't easy. When you look at the overall capital pool of like 100%, there was probably less than a few percent of all of that money that was actually willing to play in the cannabis space. But I also think from an ethical standpoint, most people got comfortable with the fact that we were dealing with a sort of pharmaceutical grade product that was really going to legitimately sick people, and it wasn't going to sort of find its way onto the streets somehow. There was no personal liability that they would have any backlash for investing in the space, because what we were doing was all, well and truly above board. There wasn't any kind of gray area that we were operating in. Because if you looked at Canada or the US at that point, but particularly the US, it operated in a very gray area. It had state legalization that was different in different states, and some states were operating adult use, but in a kind of very weird gray market. Everything was cash. They couldn't get any banking. One of the big challenges for us was definitely getting banking. So originally we started out, used the bank that I banked with privately. I set up the company, and of course, because we were called EMMAC Life Sciences, that didn't kind of create any issues initially. But then as they started to kind of like look at the website as it developed, as more people joined, and it became very clear that it was a cannabis company, I had a good number of conversations with them, with their lawyers, all sorts of things. And fair play to them. That was Barclays, and they never dropped us or did anything odd. They understood what we were doing. We were able to give them, but it wasn't easy. We had to kind of spend a long time getting the bank comfortable that we were operating in an area that was very pharmaceutical and not some sort of weird gray area.
But that's, is that accurate though? Because I think the reality is, as much as we want this, the true believers like me, even though I've never touched marijuana in my life, haven't been an Army guy and a Fed for 20 years. The reality is that we are talking about from a universal, from a more of a libertarian standpoint, is, hey, we think adults should be able to make decisions that are based off of what they feel is best for them. And we allow alcohol, and we allow cigarettes, and we allow how many other vices in the world right now. But for some reason, there's been this wall against using marijuana culturally, and it's not fully accurate that this is purely a medicinal push, right? I think you and the rest of them are still focused on, hey, this is an adult use thing, it just as much as it is a medical thing. Of course, the medical thing is critical, but so is the other piece.
Yeah, look, I'm not one to judge. Like yourself, I dabbled a little bit with cannabis when I was like very young. Thank God it was not. So when I was a youngster, we used to get hold of a bit of hash, and it was very weak, thank God, because the strength of the products that knock around the streets today, and indeed the stuff that you can get through proper adult channels, and even some of the medicinal products are incredibly strong. If you're the wrong type of person, or you have a history of, psychosis, bipolar, these sort of issues in your family, like, you are taking a big risk, because cannabis definitely has properties And some cannabinoids are not necessarily going to be your friend, but you don't know until you've tried that. And it's similar with alcohol, for example. You don't know the first time you have a beer, you don't know that that could lead to a lifelong problem. And it does for so many people. And I think with cannabis, it's the good thing for us was we only ever had to focus on purely medical, right? And when the framework came in most territories in Europe, it was very much like you really had to have a problem. You couldn't just be like, oh, I'm sleeping badly, I need something to help me sleep. Like you had to have tried numerous authorized pharmaceutical products that had not had a sustained amount of help for whatever condition it is that you had, in order to qualify to be able to get prescribed cannabis. What has definitely happened since is it has turned into a much more quasi-recreational model where, you know, the whole system has become a lot more relaxed. And now if you do have a bad back, you know, you got injured at work or you slipped down the stairs or whatever, like you could access cannabis pretty easily through the medical channels. So it's definitely become a little bit, well, a lot more quasi-recreational, I think is the best way to put it. Europe still doesn't have a framework for like proper adult use. And I still think it's the best way to do adult use is through that medical channel, where at least you are having the interjection of some form of healthcare professional, ideally a doctor, who can say, ask you some of the right questions like, you know, has your mom or your dad or your grandpa or your grandmother like ever been in a psychological intensive unit, for example? Like, you know, it's a reasonable question to ask. Unfortunately, there's no way of doing that with some of the over-the-counter products like alcohol, which is basically a simple age thing. But yeah, it's definitely a difficult area for people to kind of get their head around in terms of, you know, is this basically people that just want to access drugs legally and be able to say, hey, I've got a prescription, I'm not doing anything wrong, which I think is still much better than going to some dodgy street somewhere and getting hold of a product that you have no idea what it has in it, right? At least with the medical product that's come out of the medical facility, you know that within a tolerance of 5 or 10%, it says it is what it says it is, right? It can't be any stronger and it's not going to be a lot weaker than what it says it is. Whereas, you know, you go to the street, you have no idea. So I definitely think there is a place for a regulated framework for drugs in general. Again, this topic rages on across
Huge.
every continent, everywhere. We've got it in the UK at the moment. We've got a would-be political party challenger that wants to legalize all drugs, including crack cocaine, heroin, everything. And, you know, yeah, you kind of go, one of the big things.
Whoa. Let's just work on cannabis for now. Hold up on
Yeah.
I can't imagine a legal structure for how we use crack or, you know.
Yeah, I mean, there's
fentanyl or-
definitely a decriminalized position that some European, like Portugal, took a decriminalized position. And the idea was that, you know, by doing that, people who were real drug addicts would have a safe place to go and do the drug. So people would die less of, you know, the sort of diseases, AIDS, hepatitis, all that sort of stuff. So, you know, you can see the logic to it, but unfortunately at that point, you're allowing like the black market just to walk around in plain sight and do its worst. So it's a very difficult thing. And ultimately, I do think we will reach at some point in many, many years to come, a more regulated framework for some drugs that a lot of us would be very, very terrified of. I think cannabis, the good thing about it is no one has ever overdosed or died of taking cannabis. Like they may have died as a result of, say, suicide, as a result of mental health problems that have come, but it's, you know, you don't know that cannabis necessarily is the causation for that. My guess is it probably wouldn't help, but you know, that is just a function of all medicines, quite honestly. You know, you have that with just about every pharmaceutical on the planet.
Throw a crazy idea out there. Study it.
Yeah, I know.
Study it.
Crazy.
Isn't that madness, right? Like, let's study it. Let's study it universally. Let's study it. Let's get the best scientists and medical professionals in the world and study it, and then put it to bed. I know facts are no longer convenient for in a number of, you know, political parties these days, but or is, you know, professional medical advice. But let's actually study it and see what comes out of it. Like, I don't know how we can harm anyone in that regard, other than opening the door to things that people have felt, you know, are stigmatized, that shouldn't ever see the light of day. Well, I know John probably has some highly professional prepared questions for you, additional ones, but, you know, I would be so upset if I didn't get a chance to talk to you about from an investment standpoint, I know myself and a lot of people are looking at this is the way I look at this, and you can certainly help me understand this better, or us. This is a generational wealth creation opportunity. Probably haven't seen anything like this since cell phones, since the iPhone, the way I look at it. I mean, we haven't seen an opportunity like this that has been walled off from the financial markets, from banking, from supply, from medical support. I mean, you name it. What is it going to take for us to get past and move into this thing where this thing actually starts getting institutional investors excited? I know it's restricted now, but 280E is a big issue for us. Obviously, rescheduling seems like it's in the United States, the massive wall we have to get over. Do you think that when we actually get off our butts and get this thing rescheduled to Schedule 3, do you think that that's going to be the impetus that's going to create the wave?
I think it'll make life exponentially easier for these companies. If you imagine, like, if you're a North American operator, let's take CureLeaf as a great example, right? CureLeaf has had lots and lots of ups and downs. I mean, it's been at enormous prices. It's been at, incredibly low pricing as a stock. What has consistently happened with the company is that they have consistently managed to sort of deliver reasonably good results against a black market and a political situation that is just absolutely doing all it can to not help those companies. I'll give you an example. In New York, which we know is definitely not a conservative state, all these companies put their best foot forward. They got licenses. They got ready to put in stores, deal with all the security issues that come with that. And then New York just allowed anybody to just set up a cannabis store and start selling. Of course, CureLeaf, being a public listed company, is paying an effective tax rate of like 80% on everything. It can't write off any of its costs as a normal business can. So it is literally operating with two hands tied behind its back and hopping on one leg, right? It's just the fact that it still exists is quite impressive, is the way that I look at it, because that's not just New York. I mean, there are other states that you could certainly drop into that mix. So you got all these illegal operators who are just allowed to just carry on operating, take all this cash, no one knows what happens with it. It could just be a lot of other drugs being sold out of the place. And indeed, there's been lots of reports. There's been murders in these stores that, it's just been an absolute disaster. Had the likes of Schumer, who kept on promising, like gaslighting the public, saying, we're going to, bring in this safe banking act. It goes through the House, or the Senate. Yeah, it goes through the House 7 times or even 10 times. It gets approved every single time, never gets brought to the floor, not once. The time it does get brought to the floor, the then guy in charge steps down. It's like, oh my God, you just couldn't write this stuff. And these companies, they have the ability to become, the household name brands. And, the bigger they become, the less harm that gets done in many respects, because people are going to access these products whether anybody likes it or not. Cannabis, like we discussed earlier, it's not something that I personally like, but I can tell you now, if I got sick, I had cancer or some sort of, really problematic disease that gave me a hell of a lot of pain and meant that I would either be taking, effectively fentanyl or something instead, I would go to the cannabis immediately, right? Because alongside the traditional treatments, I would try and keep it as kind of plant-based as I possibly could. It just makes sense to me. And I get, for some people, that's not the thing, but I'd rather do as little harm as I can. And I'm willing to embrace a product that's been utilized for millennia by cultures long before that we can't even to, but it's been around for a very, very long time. In terms of what will help this industry, I mean, it definitely needs the removal of 280E. It definitely needs a banking system that is allowed to deal with money properly and provide proper banking services. It definitely needs to get to a point where state lines can be crossed, because right now you have to have a vertically integrated business in every single state that you operate in, which is just the most inefficient possible thing you could have. Right. The job creation would be enormous. It would bring in huge amounts of people who had been involved in the illegal business and allow them effectively impunity and the ability to actually work in a proper law-abiding way, pay taxes, etc. I mean, I don't see a lot of downside, right? Cannabis is not, it's not it's such a broad topic now because there are so many different cannabinoids that there are lots and lots of different ways to, have that product. And it doesn't have to be smoking. It doesn't have to be vaping. I don't know about you, but I don't love it when I'm walking down the street and I smell it everywhere. But the reality is I smelt it everywhere before there was any kind of legal framework, and it'll still be there, even if there wasn't any kind of legal framework. So that's there. That's people's choices. In the same way, I don't really love it when I don't drink, for example, either. So, I don't love it when I see people who are absolutely off their skull and, just behaving like antisocially. But I get it, each to their own to some degree. Generally, if they're not harming me or my family, people make choices, let them do it. So yeah, those are the things that need to change. But yeah, until the industry can be banked properly and properly institutionalized, it will remain in this sort of gray area. So rescheduling is critical, needs to go to Schedule 3, which would immediately get rid of 280E, and the bank, all these New York banking licenses have to be able to engage with these companies because I know they want to, right? But I still think we're very early in the process. I still think we're sort of 5-10 years away from having that sort of household name brands that we see in alcohol already in cannabis. And then I think that it does get built into the sort of pharma piece, which is very much geared towards clinical trials, exactly what we were discussing earlier. Let's actually prove real medicines that we can get market authorized and therefore can actually be properly promoted and prescribed. You'll always have the kind of Schedule 2, which is the slightly gray area where you're effectively getting a product that's a kind of generic product. So like whatever, 20% strain cannabis oil, 20% THC strain cannabis oil. Cool. And then you'll have the sort of over-the-counter bit, which will be blended with the sort of non-intoxicating products like CBD. And that's what, you can walk into these dispensaries and have been able to do for a long time in lots of parts of North America. So it definitely needs to change for the business to operate properly and reach its potential in terms of a, big tax generating, big employing sector that, actually has a great place for people who have maybe been on the wrong side of the law to come into something that's the right side of the law as well.
Yeah, Ed, you touched on so many areas of compliance that are really kind of fascinating that really hadn't, Rob and I talk about compliance all the time from a cybersecurity standpoint, where we look at it as a growth enabler. Like if a company adheres to the compliance regulations, for us at cybersecurity, there's more opportunities that are available for them over the long run. And so it sounds like that's the case within the cannabis industry. But with those changing frameworks, it sounds like the New York firms that were trying to do the best thing and comply and normally would be rewarded for that kind of got screwed over with that in that instance.
Yeah.
But over the long term, you see compliance as being kind of almost mandatory for a growth of a firm to get there. And then
yeah, I think the regulatory, they need to drop the scheduling piece, but they need to make the regulatory piece even higher, both on the product itself, the handling of, customers or patients, whichever side they're coming at it from, but obviously both in most cases, because, your CureLeafs, for example, of this world, they're dealing still with medical territories, but they're also dealing with adult use. So on all those fronts, that also goes back to the actual production of the raw product itself as well. So, I mean, the compliance piece is massive across the whole thing. Then, of course, you've got the sort of anti-money laundering side, just to make sure that us consumers or patients know that these companies are being properly kept in check. I think as a company, I have a couple of finance businesses, one that does private client stockbroking. And I mean, the compliance is, through the roof nowadays, but there's a barrier to entry. If you don't have that, if you're not willing to do that, you can't play in it. Or if you do, you're playing in it illegally. So I think it's a good thing when, if we link that back to like alcohol sales, for example, if you're a guy that serves a minor alcohol, you get a massive personal fine, and the store that you work for also gets a massive personal fine, potentially loses your license, potentially gets shut down. I think that's how it should be. At the moment, we don't have that with cannabis because our kids, they can't go and buy a beer from, the local off license or whatever, but they can get cannabis within 15 minutes if they go down to the local park. I mean, that is not a good place to be, I personally, I'd rather my kid was having a beer than smoking cannabis. I mean, my kids are so young, thank God it's not even on their radar. But, that was another thing in Canada that helped push that law through, basically saying, hey, we're going to stop these kids being able to access. And of course they haven't, because, the rest of it, the conservative politics of the whole thing is just holding everything back and allowing the black market to just flourish. And as Rob mentioned earlier, the black market is an incredibly intricate business that has been perfected over decades, while the rest of us have kind of been sleepwalking and kind of going, oh, well, not sure about this. We just think it's bad, not willing to figure out if it's good or bad. We know it's bad. End of story. Nothing to discuss. So many things in our lives have been, not looked at properly because of this, and it's not done any of our health any good. I mean, you look at the US, and I'm a big fan of RFK Jr. because I get it. Some people think he's a bit crazy or whatever, but actually he's the only guy I've ever heard in politics who actually seems to care about what people are eating. And, when I was last in the US last summer, I mean, I remember my wife and I went to the store and we were just looking at the food and we were like, this is literal poison. This product it's actually got poison in it. And like, that's okay to eat. How the hell did we reach that place? And like, it's quite different in Europe. We have quite a lot of bad products as well, but it feels like the regulatory piece here in Europe around food is just so much more advanced and aggressive on so many different types of products. Yeah, I just think whatever industry you're in, if it's got any piece of regulation, compliance is only going to get more and more intense, and it's part of playing in said industry. So I think it's a good thing in general, because it means that the cowboys find it a lot harder to do stuff in said industries.
Do you see some of these criminal organizations trying to legitimize their operations and move into the main, I guess, are they going to start complying, or or is it just such a wide chasm between the two that they know how to operate in their black market area, and they're just going to focus on
I think
being
at the
more
moment,
efficient
there's just not enough pressure on them with the legislation in place for them to have to really worry about it. I'm sure they look at what's happening with the cannabis industry as okay, cool, we'll keep an eye on this. We'll see how it goes. This is going to form our thinking about when they maybe start dealing with sort of harder drugs, maybe when that becomes a thing. But I think if I was a criminal organization at the moment, and unfortunately I don't think like they do, because I could probably learn quite a lot, but I suspect they're not very worried. They're probably kind of just laughing at how stupid all these politicians are being, and the conservatism around these things that are happening, whether we like it or not. And we just, for whether it's to virtue signal or, we're just too scared to find the answers. And I think, when we're scared of something, that's when we need to know the answers, right? Whatever it is, whether that's like military type stuff, whether it's pharmaceutical, whether it's, common foods that we all eat. We should know the answers. And when we're scared of sort of knowing the answer, then you damn sure need to know the answer. That's my kind of view on it.
Yeah, as opposed to just reacting to whatever your gut is.
Exactly. But yeah, I think definitely, in all the industries, and at the moment I have, as I said, businesses in finance, but I also have businesses in the food sector, or one business in the food sector. And yeah, the regulatory piece is certainly financial, has been getting more and more that way when, as every year goes by, and food is, it's right up there with pharma now.
So Ed, what do you think? I mean, are we at the edge? Are we imminent for rescheduling? Do you think, is this a 3-month, 6-month, 9-month thing? I mean, what's this going to take to get us over the edge to at least start moving? I mean, it sounds to me like our president at least supports it from his comments and directing our DEA to get on with it. But then, of course, our DEA is well known to be able to stonewall for extended periods of time on things that they don't necessarily support. So we'll see about that. But what are your thoughts from your side? Is this imminent?
I hope in the US, you're looking at it's got to happen at some point in the next 2 to 3 years. The issue is there's just so many problems at the moment that every time a new big problem emerges, this kind of goes down the pile. I think RFK is a big one for bringing about this change, quite honestly. But I think and rightfully so, I think his biggest mission at the moment is to try and sort of improve the sort of basic day-to-day health of Americans. And I think that should be his priority. So a lot of it is geared towards food. I think pharma is also right up there as the other piece, but I think that's just a harder beast. I think the great news is we seem to be in a place, certainly in American politics, where the pharmaceutical companies are kind of being shown for what they are to some degree, in terms of they clearly years ago realized that, hey, the right are the supposed bad guys all the time. We need to get in with the left. We need to start funding them and doing all the stuff there, because that's how we can really like have our own way. And I think with the likes of Trump and RFK and those guys, they don't seem to be particularly aligned with pharmaceutical. In fact, they seem to be kind of attacking it. So I think that's a good thing. And that can hopefully bring about change on multiple fronts, both food, pharma, and of course, topics like cannabis. Yeah, I think it will definitely happen, but I think it will then be a sort of false dawn to some degree. I think the industry will run massively initially. It'll make a lot of mistakes. It'll need to, go back over the issues that it's created for itself. And a lot of that will be around the compliance piece and the regulatory piece. But I think, in somewhere in the region of like 5 to 7 years, I think the industry could look very, very, very different and much more grown up and actually quite consumer friendly. That's my belief. But I think there's going to still be some hard yards before we get to that point.
Yeah. So you've been on like multiple ventures, and so like different, experiences of kind of working in ambiguity and building the business. Looking back, what is one thing you'd never do again? And this is my last question for the day too.
One thing I was I was really young when I was young and really enthusiastic, and I was just getting into business. I believed that I could get the job done, but I don't think I really believed in myself enough to kind of actually say, well, hey, where's my economics? What do my economics look like if I get this right? I was kind of like, let's get this job done and then we'll worry about that later. And that's one thing I'll not ever do again, in terms of just have the enthusiasm to go and get the job done, but deal with it in a kind of mature way, as it, structure things properly before I get going. If I went back I've kind of repeated the same mistake a little bit across both EMMAC and certainly one of the ventures that I'm involved in, where because there was a group of founders, I had quite strong views on how much we should dilute and how much we should raise and how quick, and certainly some of the people that we got involved as investors. And I think I would, if it was afforded again, I would probably wait out a little bit and make sure that I really understood what the motivations of those people were and their time horizons, because I think the worst thing you can have when you're busy building a business is to kind of have your shareholders who are kind of semi-involved talking about the business to everybody else, kind of trying to pitch it to sell it, and that's what I felt at a few times. It kind of undermines the process of going, look, if you build a business and you do a really good job of it, you'll have lots of optionality where it comes to raising capital, where it comes to paying yourselves very well if you execute well. So yeah, you definitely, if you can know very early on exactly where your shareholders sit, even if you know them really well, like you do have to have those difficult conversations of saying like, look, I want you involved, but like these are the hard lines. And if they're not up for that, find someone, because there's always someone out there who will do it. But I get it. Desperation can sometimes, or enthusiasm, but take more time to just be absolutely certain of who your investor really is, and make sure that you kind of don't let them have, bring their strategic value in, but, make sure there are hard lines.
Okay.
Makes sense.
Yeah, that certainly resonates, because I'm sure that like with enthusiasm to raise capital and kind of change your ability of what you can do and how quickly you can build, there's that natural enthusiasm. Just write me the check and we'll figure out the details later, but you
just want to get on with it. Right. And actually, where the capital comes from is really important. And, often you're better off getting sort of slightly taking longer to get that capital and doing it the right way. But also that teaches you to be leaner in the process.
Mm-hmm.
And it's so easy. One of the biggest mistakes we made at EMMAC, for example, was I think there was a general unease with certainly the consumer piece where it came to the over-the-counter kind of wellness products. And we wasted a lot of money on that when we didn't need to. We hired people that were just totally wrong for the job. And I remember saying, of the board, there was kind of myself and one other, and we were just like, why are we spending all this money on like a branding agency like this? It's an okay brand, but it's not like, we can all see it's not that great. So why are we wasting all this money on that? Because inevitably that's going to lead to us needing cash sooner than we would like. And that, we don't know whether the market's going to be in a good place or a bad place there. So let's just be a little bit more sensible with capital. And I think perhaps we didn't, it's very difficult when you end up in a kind of board situation and it's all got quite serious. You need to kind of stand your ground, do it in a respectful way, really think out and present why this is, quite easily going to be a mistake, and maybe just hold off for a little bit because the value that it's going to create isn't really worth the risk.
Yeah. No, I mean, makes total sense. Like learning when to pivot away or just to kind of avoid certain rabbit holes. That's the thing. This is just so many rabbit holes you can go down.
You put it a lot more eloquently than I did there, but it should be a great, fun thing full of kind of joy, hard work, sweat and tears and all the rest of it. But, it should be something that the bit that you look back on and kind of almost feel most proud of, because whenever you're building a business, and this is my experience and a lot of other people I speak to, when you've sold it and maybe you have a period that you're still in the business, but ultimately when you've sold it, you kind of emotionally, you're not as involved in the business because it's no longer something that is yours anymore. Yeah, it's a pretty miserable affair, actually. I genuinely think, the best bit of it's always better to travel than arrive is my best way of putting it. You might feel a bit of satisfaction. And of course, it's nice to be sitting there going, oh, cool. Well, financially things are in a better place. But purpose is the thing that like makes it all worthwhile, right?
100%.
So the longer you can stay in the thing that you've built, or at least, there comes a time, obviously, when, I guess age is a factor in that, of course. But, I think for young people out there, or youngish people, and I would include anybody well into their kind of 60s nowadays, if you don't have to sell and you've got a business that you can structure so that it's actually paying you very, very well, and that you're able to take, good income out of the business, you're able to be efficient with that, you got to think really carefully when you sell a business, because your whole existence changes a lot, your whole purpose, who you are. And, thankfully, a lot of people like myself, we got families to kind of, they'll always make you, that'll always humble you anyway.
Yeah. They'll fill the time too.
Exactly. There's also that other side of things is, you want to, certainly for me with young kids, I want to appear to show my kids a good work ethic, and that it's critical to have purpose. So
this is a whole nother podcast idea, John. The scam that is retirement, the word retirement, and how much BS it is when reality of everybody works their entire life towards retirement, and then they get there and they're like, well, now what? Holy crap. I don't have anything to do. My wife says I have to leave the house.
Yeah, exactly. Well, and that's the other thing as well. It's like, all these guys who say like, oh, I just want to be like, I want to be free. It's like, you're never free. You're always a slave to somebody, and not in a bad way, like to your family, to your friends, to, you always, like, there's always someone to answer to. There's no such thing as like this complete idea of freedom. But I think freedom is knowing who you are, what you do, what your purpose is, and embracing that, and being the expert in said field that you're in. That's like a really great place to be. If we went back to like tribal society, you're the chief, right? People want to come to you, they want to get advice from you, all that sort of stuff. You always have a place in the world. So yeah, it's just an interesting takeaway. And I've had lots of conversations recently with friends of mine who've been vastly more successful than me. And, I was with a guy the other day who, he sold his business, and he was, had a very large shareholding of his own business still for well over, I think it was 150 plus million. And, he's got all this cash now, but he's miserable. Like, he went and played golf a lot. I've done the same thing. You go and play golf. I did a lot of motorsport, but sooner or later you're like, oh, geez, man, like, well, what am I going to be doing?
All right, now let's get back to work, right? Yeah.
People need a purpose. That's true. Our mission.
Yeah.
Well, Ed, hey, we went a little over. I think Rob's ready to go for another 3 hours. But I think we've run out of recording space. But
I think we're gonna have a call. We're gonna have a call soon. I got a few more things I got to pick your brain about. So
no problem. Well, I'd love to learn more about the cybersecurity space, because it's definitely an area that my knowledge is lacking. Thankfully, I've worked with some good people who are kind of over that, but it's it's a very, very interesting sector. And I think, like I said, one thing that it does scare the crap out of me, apologies for my French, but yeah, how vulnerable, just I am with my own kind of a technical setup, for example. And, if you don't know, it's hard to know. You can have your VPNs and all this sort of thing, but it's nothing really in the grand scheme of things.
If
So
only there was a place you could go to figure out
yeah,
where we can help.
well, yeah, for anyone who's listening, definitely check in with the guys because they obviously know what they're doing. And I think this is a great way to sort of, talk about what you guys do as well. So yeah, you should interview each other. That would be a good thing.
Yeah. Well, this is our first take at it here. So, Ed, I really appreciate you coming on the podcast, and glad to have a conversation anytime, with the cameras off, and just certainly work together, or just pick each other's brain whenever it makes sense.
Sounds good to me. Thank you so much, guys. Thank you, Jonathan. Thank you.
All right. Thank you, Ed.
Thank you, Ed.
See you very
Cheers.
soon.